My name is Sydney Smith and I did my project on panic disorder. Panic disorder is a type of anxiety disorder. People with panic disorder often live in fear of future attacks, which can lead to avoidance of certain places or situations. The condition can significantly impact daily life, but with proper treatment, many individuals can manage their symptoms effectively. Some examples of physical symptoms when having a panic attack are chills, chest pain, sweating, and trembling or shaking. Emotionally, a panic attack can feel like you detached from yourself or like you're going crazy. Panic disorder has certain markers that make mental health professionals able to diagnose this disorder accurately. Both nurture and nature play a role, and their interaction often contributes to the development of panic disorder. Some examples of nurture causing panic disorders are your childhood experiences, including abuse, neglect, and instability. For some people, genetic factors play a role in making them more prone to panic disorder, and for others, there are environmental triggers that could be the primary cause in most cases. It's a little bit of both. Panic disorder disrupts the brain's fear center and causes a constant cycle of fear that leads to attacks. The language that we use when talking to ourselves reinforces fear and causes ongoing panic symptoms. There are many emotional effects that causes people with panic disorder to basically feel helpless and depressed. Socially, people with panic disorder avoid being in places where they associate with having attacks, so it can be socially isolating. People with panic disorder see it as a personal failing rather than a mental health issue and struggle, both emotionally and morally. People with panic disorder have moral fatigue because they are drained by always trying to manage their symptoms. Panic disorder appears differently in men and women and across different cultures. An interesting fact is that women are twice as likely to develop panic disorder over men. Some of the reasons are listed below. Panic disorder shows up differently in men and women. For example, women are more prone to emotional symptoms, while men are more likely to experience physical symptoms. There is a large scale of cultural differences in panic disorder. For example, in the United States, there is more awareness of the disorder, which does help in treating it, as opposed in the Middle Eastern cultures. It is not as much recognized, therefore not treated as much. In many cultures, there is still stigma attached to mental health, and many people don't seek out help. The treatments for panic disorder vary, but mostly are psychotherapy, using medications, and changing up your lifestyle. There are several educational programs that you can use when you have panic disorder, including online apps that help us use self-guided support. A peer review study shows that there are several differences in how panic disorder shows up and how it is treated depending on the age of the individual.